Hello, everybody, and welcome to another edition of Health Matters, the community access television show of the Worcester District Medical Society here on WCCA TV, channel 194. And today we have a really great edition for you. I think you'll be really interested. A very dear colleague of mine, Dr. Mark Zonfrillo, is here to talk to us a little bit about the incredible expertise that he brings to the Brown University medical system. He's a professor of emergency medicine and pediatrics there, and he's one of the first people to hold a degree in medical informatics. This is a relatively new area whereby the skills that you need to navigate the electronic medical record and all the different electronic platforms that medicine can be used to promulgate education and protect patient information. These are all new topics that Mark is kind of one of the world's experts on. So I wanted him here because in so many ways, electronic medical record and just in general, what we're doing on the internet with medicine has changed the face of medicine. And I want to understand better how he looks at it. Is it a blessing or a curse? Everyone's talking about, Chat GPT and is AI the end of the universe? Maybe we'll find out today from Mark whether it is or not. Mark, first tell me a little bit, how did you get interested in this? How did you make this journey through medical school and then you come up with this particular specialty interest?
Yeah, first, thanks so much for having me on the show, and it's a real honor to be here. And just as a point of clarification, although I'm not a card-carrying medical informatician, I play one on TV. That's what I like to say. So, there are folks who are board certified in it, and I am not currently, but I do have a great interest in informatics and the way that it can be used to gather data and to address public health problems. My interests in pediatrics and pediatric emergency medicine and injury prevention all kind of started actually in medical school. And I realized that, injury was the leading cause and still is the leading cause of death and acquired disability in children, and injuries are preventable. So how can we prevent injuries? Well, there's different ways and strategies that we can prevent injuries. There's the classic 4 E's where you have education and engineering, economics and enforcement, different ways and different lenses that you can look at trying to prevent injuries. But it can be very challenging. And, research in general is a way in which you can generate or identify novel data in order to answer research questions and make changes. And so I think when you overlay some of the principles of injury prevention and the fundamental principles of research, clinical informatics and informatics in general are ways that you can gather data that can be useful to apply to injury prevention. And I did get a master's degree in epidemiology, and for those who are unfamiliar with that term, epidemiology is the study of the determinants and distributions of health and disease. So it's the who, the what, the where, the when of any type of disease. And in my case, I like to, my focus is on injury, and in particular childhood injury. So as we have, more automated electronic health records, the data that are available at a local institutional level, but even regional and national level, and then certainly as we think about social media and now artificial intelligence, AI, there's a wealth of data, and there's a way to be connected like no way we've had before. But with that, comes risks. And what we're seeing now is, in addition to having the social media and data be a benefit and to promote health, it can also serve to put children at risk of, in the case of the things that we're studying, injuries, either by self-harm or by injuring others.
Yes, Mark, you hit on the nail on the head on a case that I was going to bring up that I learned about through my daughter, who's going through a pediatric psychiatry fellowship in Pittsburgh, where she had to consult on a child that tried to complete a suicide after being cyberbullied. And we had a famous case of cyberbullying in Western Mass about 15 years ago, where a bunch of teens picked on a young girl, I would say probably 14, 15-year-old, in the early days of social chatting, and she did indeed kill herself too. So some of these negative consequences of our connectivity and the feeling that children can't get away from that has been weighing on me a lot as a public service, public health guy here in Worcester. The mental health crisis after the pandemic is on a lot of people's minds, and I think perhaps so much time with screens during that time, getting education that way, but also getting communicated that way, might have made this worse. Where do you feel we can go to alleviate some of that?
Yeah, and I'm sorry to hear about that case, and unfortunately, this is becoming far too common. You hear of cases of this cyberbullying, and even social media challenges, and I can touch on that a little bit as well. But I think what happened was, social media has sort of really become a big problem. Certainly for adults and young adults, but also for teens. And what's happening is kids are getting exposed to social media and screens earlier and earlier. The American Academy of Pediatrics, I know you know the organization well, I've worked with them for a lot of your career, as have I, have now put out policy statements and recommendations surrounding social media. And the short version is you want to really delay the introduction of social media as long as possible. You want to limit the amount of social media, and you want to make sure that you're having discussions with your kids of social media as you would with any of their behaviors. So, if you don't want your kids to go to a certain party or a concert or hang with a certain crowd, you would talk to them about it, and those same rules apply to social media. But it's a very strong pull. I have a preteen and a young teen daughter. I have two daughters, and there's a want to sort of belong and to be part of social media, especially when their peers and their friends are doing that. But these discussions need to start early, and they need to happen often, again, as they would with any other aspect sort of parenting. And when we think a little bit about some of the social media challenges that occur, this is also becoming very common. And what I mean by social media challenges, that you would get challenged to do something, whether that's, okay, I want you to take a spoonful of cinnamon in your mouth and see if you can swallow it without any water for a minute, or eat a laundry pod, and the list goes on and on. And some of these may sound harmless to the individual participating in them, but some of these can actually be quite harmful and result in serious injury, permanent injury or even death. And there are a lot of strategies that can be done to sort of help prevent people from participating in them, but they are being propagated by the availability of social media and the way that a lot of these things can spread, which is overlaid with normal behavior of adolescents with peer pressure and wanting to fit and wanting to belong.
And we just had an unfortunate incident here you may have heard about in Worcester, where a young 14-year-old ate one of these ghost pepper chips.
Yes, I did.
And it's not clear that that was the terminal event. I guess the formal findings from the coroner aren't back yet, but
Right.
that was the certainly the event that preceded his demise, and a lot of that came from some kind of a challenge, like you've talked about. Yeah, when we were together in the injury prevention arm of the American Academy of Pediatrics, we saw a lot of these Tide Pod challenges coming through, and I think that the thing that was so frustrating was that there were good challenges too, because remember there was this ice bucket
the ALS ice bucket chest. Yes.
So it's like there's a spectrum, and we know that the adolescent brain doesn't really mature in a way that they can judge what is a good challenge or what's a bad challenge, what's a safe thing and what's not a safe thing, until probably they're much older than adolescents. So I think that this is a real stumbling block to a lot of parents. I can't tell you, and I know you are probably closer to it, my kids are grown, but you walk into a restaurant now and you see parents and kids and everybody's on their phone.
Everyone.
Nobody is talking to each other,
Yeah.
But I want to talk to you about another aspect of this, because I just attended a seminar on how to be a good messenger about patients that have long-term sequelae of the COVID infection. And one of the modules that had been put together in this training course was how to sell your story if you're suffering from long-term symptoms of COVID to the doctor, because the assumption was being made the doctor was not likely to believe you because your symptoms were vague, you couldn't really describe them well, you didn't have a start date, and there was no simple test to verify them. So I took a little bit of exception to the way it was being presented, because I wanted to say that, doctors are very much harried and under the gun, and, these are complicated patients with lots of different, issues, and to really sort through them and have it happen in a 15-minute visit is very difficult. So I'm not trying to make excuses for a doctor blowing off a patient. And the comment that came back to me says, but the doctor doesn't even look up from the computer. Mm-hmm. What do you say to something like that?
I think it's I agree, and I think that it's challenging because there's so many pressures on physicians to be able to do everything, like you said, in a very limited period of time, and there's huge burnout associated, and one of the major grievances of physicians and other healthcare providers is the notes. The notes are always piling up, and so anything that they can do to get an edge, and one of those things is to complete the notes in real time. But of course that then the patient patient provider relationship and connection suffers greatly. So I think that, again, we have to think of creative ways to look at this. And there are informatics solutions to this. There's clinical decision support that can be integrated easily and seamlessly in the health record that can be used to screen for and collect data on all sorts of you know, health issues. And there's creative opportunities to do so. For example, I'm working with some folks at a couple of different institutions, and we're looking at ways to optimize child passenger safety screening and messaging, and we're using informatics to do that. And we can do that in an asynchronous way. You know, a child's waiting in a busy emergency department. A child's waiting in an outpatient pediatrician's office. Have an interface set up where you can give them a tablet and say, hey, why don't you fill out this questionnaire? And, or after their visit and after you've seen them, they can do something on a portal. Something that allows for the provider to, much like when you're like screening someone before they come in to make sure all your meds are correct and your allergies and your address is up to date, do some health screening during that time. And then you really can get at a very customized visit that optimizes the efficiency of that time that they have together. You know, when we talk about precision medicine, we typically think of things like, you know, targeting genetics of cancer. But precision prevention was coined by some of my former mentors, and precision prevention is really customizing, in this case, injury prevention efforts for that particular patient, because certain patients in, you know, different areas of the country or different areas of a state or region, whatever, may have different baseline safety behaviors or different needs. And so getting at that sort of customized prevention can be very helpful. And doing that with a way where you can very easily, in a technical sense, integrate that within the health record. So to answer your question about, you know, having patients answer questions about long COVID, you know, maybe you have them do that in advance and it populates a record and then a form, and then you can come up with some standardized score or something, and then that way you have those data on that individual, and so that provider can follow them over time. And furthermore, from a public health perspective, you can have those data on many different individuals, and you can use that for the purposes of research to help the cause further.
That's fascinating. The advances in technology and how you know, these little tablets are just super powerful is really quite an advance in and of itself. I wondered if you had any thoughts about the kind of chat GPT kind of approach to a medical note, because that is being talked about a lot at our institution, that somehow built into the electronic medical record, the computer will have a way of listening in on your dialogue and creating a note as you go, so you can converse with the patient and make the eye contact and have the direct connection. And meanwhile, secretly behind the scene on the screen is appearing a note that the computer is populating with the information points that you are eliciting from the patient. Is that like a fantasy, or that's going to happen?
I do not think that's a fantasy. I think that is going to happen, if it's not happening already in sort of, you know, limited sort of beta testing, if you will. That is something that we will absolutely see. But as the saying goes, with great power comes great responsibility. And so you have to ensure that what you're doing is, of course, you know, confidential and respects patient privacy. You have to ensure that it's accurate. You know, you can think of like tons of implications for this, from even like medical legal implications. Well, that was what the, you know, the chat GPT, or that's what the AI dictated for me. There's also this concept in AI called hallucinating, and it's a phenomenon that they say when AI, so let's say you ask AI a question, and they answer in this sort of very confident manner, very matter-of-fact, definitive manner, people might take that at face value. But experts or people who try to verify the information might find that actually that's false, or a part of it's false. But it's presented in such a confident manner that you take it at face value. And that's a concept that they're now labeling hallucinating. So you'd have to be careful about, the limitations of AI. But you bring up a good point, which is if you can do that and optimize the efficiency of the note writing, which is a huge barrier and a huge pain point for providers, and increase the the irony there is thick. It's like you're applying more technology to increase the human connection factor, but in fact you could do that. And if you're able to do that, then yeah, I mean, I think AI has its place. The other way in which AI has its place, and I'm collaborating with some colleagues on it, is for example, injury surveillance. So when we think of things like these challenges, as you know, we have these diagnosis codes for injury. So it'll be like, broken humerus or concussion. And then we also have these mechanisms of injury. So struck by an object, or a fall, or a motor vehicle crash. Well, with a lot of these, I'm just tying our earlier conversation with a lot of these social media challenges, you don't have those mechanisms of injury. You don't have laundry pod ingestion as a mechanism of injury in the computer, or even things like button battery ingestion, or whatever it may be. But with the use of AI and natural language processing, machine learning, you can gather those data in real-time surveillance and sort of see how much of a burden or a problem it is, and you can see where things are, patterns of where things are occurring, and that can help with your prevention efforts.
And I think there's nobody that makes me more optimistic about this topic than you, because I think, well, you're always a beacon of optimism in the interactions that we've had. So what do you think is the next great thing that's coming down the pike for informatics in just a minute or two that we have left?
Yeah, I think I think clinical informatics, it's going to be integration of data systems to allow for more powerful real-time surveillance of data related to all aspects of health, not just injury, but any aspects of health, and using those data for the purposes of research, answering questions, and having and addressing public health solutions. And with that comes this kind of precision, this promulgation of precision medicine, and really expanding it to all types of health-related issues by integrating the power of clinical informatics and artificial intelligence as it relates to the healthcare systems, as it relates to social media and society in general.
Very, very fascinating future that we're looking at, and I'm glad that there are wise people like you to help our young trainees through this process, because they probably are as bewildered as some of us old guys, but they're very adept, I know, at the social media piece. I want to thank you, Mark, for being such a fantastic guest. I am very, very envious of the knowledge base that you've accrued, and very grateful that you're so willing to disseminate it to our public here. So we're very lucky out there in WCCA TV land. So think about this the next time you're seeing your doc, that maybe he'll be looking at you a little bit more, thanks to some of the innovations that Mark has described. And in the meantime, I want to thank you again for being here. And here at WCCA WCCA-TV and the Worcester District Medical Society, we continue to be very proud of the cutting-edge people that we have visiting us. It's really been such a treat to have you here, and we continue to hope that in the future our viewers will learn as much as they have today. So this is Dr. Michael Hirsch here signing off for another edition of Health Matters. Be sure to pick us up either on channel 194 or at www.wdms.org at our website. And have a great time, and see you soon.